So thank you so much, Monica. I'm so happy to have this opportunity. As Monica said, the title of my talk is Nurturing Roots to Reach New Heights, Revisiting Foundations of ACT as Clinical Behavior Analysis for Mastering Flexible, Process-Based Implementation. I know those are a lot of words. And I hope that by the end of the presentation, it's very clear why each of those words are here. So the first thing I want to say, and just to kind of acknowledge this, is that I come to this work, I come to this work, to this moment, to this presentation with a very particular perspective. And there's nothing special about me that I have a very particular perspective. In fact, we all do, right? We have a very particular path that we've walked. We have a particular learning history. We have a particular repertoire. And so in any one moment, in any one context, the way that we understand and react to that moment is bound by our interactions with similar contexts. And what that means is that there may be some things that I say that really fit with your perspective, that click into place, something you've thought about, or that feel like you could be giving the presentation yourself. And when that happens, it'll be little parts of our history that tend to overlap, that tend to be the same. And there will be times that I'm saying things that you're going, what? I've never thought about it that way, or I've never looked at things that way. And those will be parts where our learning histories do not match, right? Where your interactions with the things that I'm talking about have been different from my own. I mentioned this because I want there to be room for both. I am going to be asking you to try on this perspective in particular for just this little chunk of time that we have together. And I want you to use the question and answer period to resource yourself to where even in those parts that don't match my perspective to your perspective, that we can resource you to help you to be able to try this perspective on. I want from here this to be a perspective that you can try on any time, right? That you can kind of have in your pocket or in your bag and pull out and say, how would I look at things from this perspective? I also say this to acknowledge that my perspective is not the same as everyone who does ACT or everyone who does clinical behavior analysis or everyone who is a contextual behavioral scientist. You know, it couldn't be. We each have our own perspectives, and the best that I can do, I think, is to offer you my own in authentic and clear a way as I know how to. I said that I wanted you to be able to try on this perspective, and we could look at it as a lens. The other thing that we could look at it as is something like a compass. And what I really care about in terms of trying on this perspective is not how you think about things, but how you interact with clients in clinical process. So when you're actually engaging in clinical work, I want this to be like a compass that you could pull out and that it could come to direct your work. It could come to point you towards some options for your next move, for what you might do or say next. I mentioned process in the title, and that's where we're going to kind of start with the didactic piece. So bigger context, process-based therapy is hot. It's popular right now. One way of saying it, somebody wrote in a blog recently that process-based psychology has gone pop, or process-based work has gone pop, right? It's quite popular and really a buzzword. One of my colleagues used to say it's the kind of word in clinical psychology that everybody says and nobody means the same thing. So I want to be really clear over the course of the meeting. One of the goals that I have for us is that you'll be really clear by what I mean by process and what I think a clinical behavior analytic orientation speaks to in terms of process. You know, this emphasis on process actually fits really well for folks who have some exposure to acceptance and commitment therapy or contextual behavioral science, because for us, we have always defined ACT in terms of its functional mechanisms, in terms of what happens functionally in the room, not what happens topographically. So some approaches to therapy you can recognize with particular exercises or metaphors, and there's certainly popular exercises and metaphors in ACT. But, ACT is really defined as an intervention that serves to move people from inflexibility to flexibility. And you hear in there both an understanding of what poor psychological health is, that psychological or mental illness or struggles are defined by psychological inflexibility, and that as we work, what healing looks like is that folks becoming more and more flexible in their world. Right? If we sort of unpack these terms a little, the idea that when we are not doing well, when we're struggling mentally, that we're having trouble being with our thoughts and our feelings and our experiences in different contexts in ways that allow us to move meaningfully and effectively, that we kind of shut down and get rigid. And that over time, right, what ACT purports to do is to increase flexibility, to open us up to our mental experiences, our emotional experiences, our physical experiences, and to teach us to pick out what opportunities we have in the moment to be successful in ways that are meaningful to us, and to orchestrate those courses of action, to actually engage in those behaviors. So for us, process has always been central in the definition of ACT. It's one of the things that makes it so easy to disseminate. Traditionally, people unpack this psychological flexibility model in terms of 6 components. And just in case folks are familiar with this, I want to briefly kind of speak to that. We might call these middle-level terms. It's a model of different components of ACT. And this model, the psychological flexibility model, then captures, because this is process-based therapy, it captures both our understanding of what psychological struggles look like, which are struggles in these 6 domains, of what psychological wellness looks like, which are strengths in these domains, and of the actual processes of ACT. So you may have heard people talk about things like experiential acceptance versus experiential avoidance, or cognitive diffusion versus cognitive fusion, or committed action versus persistent inaction or avoidance. Right, so each of these components is one way to sort of come at or train acceptance and commitment therapy, and one way to use it in the room. For me, those are, like I said, a mid-level model. And when I say middle level, what I mean is that it's situated between how we might talk to just anybody out in the world, our clients, our grandmother, our neighbor, the postal worker, and the more basic terms that come out of the scientific lab. So middle level terms are designed to really make use of the basic terminology, the basic findings, those scientific findings on which our work is based, without people having to be experts in that jargon, without people having to be basic scientists themselves. So this is a great fit for therapists, because most of us as therapists are not actually basic scientists, right? Some of us feel comfortable reading basic science, some of us really don't. So this mid-level terms are what they're supposed to do is help us to do ACT, or whatever treatment we're doing, but here ACT, to help us to do ACT in a way that's consistent with those basic theoretical underpinnings, the basic findings, and with our philosophical foundations. Most of the time, training starts there at the mid-level model because of this understanding that might be most accessible to people. For me, though, we're going to start somewhere else. We're going to start all the way with the philosophical foundations. My sense is that those philosophical foundations actually have a lot to offer in terms of clinical implications, even if we just stop there. And then we're going to build up and talk a bit about the theoretical foundations. We're going to play with a simplified way of approaching behavior analytic findings and behavior analytic terms in a way that's accessible in the room, that we can bring that to bear like a compass to guide our actions in any moment. So one part of the compass might be our philosophy, one part of the compass might be our theoretical, our basic science foundations, and then the specific targets that we engage, what it is that we actually build in the room that comprises what this client looks like as psychologically flexible, that will be firmly grounded in those theoretical and philosophical foundations. Our philosophy is sort of odd in some ways, at least the roots of it, because we didn't start by looking at big philosophical positions with regards to ontology or epistemology or structuralism, or that our work really started, at least in contextual behavioral science, really started with sort of an arcane, little known piece of work by a guy named Stephen Pepper. And what Pepper suggested was not a whole philosophical system. What he suggested is that you could look at different approaches to science, different theoretical approaches across the sciences, not just psychology, not just the behavioral sciences, but across all the sciences, that you could look at them and see patterns. You could see what he called worldviews. And what he was trying to account for was the idea that some folks in different scientific camps are never going to be able to understand each other. They will never be able to have a conversation that benefits both of them. And what he attributed this to are a couple of different things, these different worldviews, and that these different worldviews, what they include are different, what he called root metaphors, that there's specific metaphors for the nature of the world, our sort of understanding of the world and the job of science, the relationship between wholes and their parts. So which is primary? Are the parts primary or are the wholes primary? And finally, how we understand truth or the truth criteria. So in ACT, our foundations philosophically are functional contextualism, and those come out of a particular worldview that was defined by Pepper. The biggest differentiation that we're going to spend some time with today then is that truth criterion idea. How is it that we know, as scientists, basic scientists maybe, or as appliers of science, how is it that we know what is true? How do we approach that search for truth? And what's the relationship between our understanding of truth and how it is that we come to act, how it is that we come to engage in that application of scientific knowledge or scientific pursuits? So we are contextualists, and in contextualism, the orientation or the worldview that Pepper described here is really kind of odd for many people. Contextualism, the root metaphor that is the metaphor for everything, for the way that we understand the world, that the root metaphor is the act in context. Act because every event is constantly changing and unfolding, and in context because we can only understand that event by understanding everything that is not that event, everything that is outside of that event. And for contextualists, we could apply this act in context metaphor to anything. We just happen to be interested in behavior, but it could also be applied to different aspects of weather or different biological pursuits or categorization of different phenomena in the world that are physical. So because for Pepper, these are worldviews that are represented across the sciences. So our root metaphor is the act in context, the idea that always what we're looking to sort of capture is an event in flight that can only be understood by what is around it, by what is not that event, by its context. For Pepper, contextualism also espoused a perspective that emphasizes the whole over its parts. The idea that we can't add up all the parts of something in a way that causes us to really appreciate the whole, that instead the whole is what is primary, the everything, right? The totality or unitary whole. If we really push this, it could be the whole world or the whole universe or even stretching out over time, right? Everything that ever has been and everything that ever will be, or maybe even different potentialities like a multiverse. If we really push this contextual perspective, the whole is truly an expansive concept. The idea that anytime we're naming anything that is not the whole, anytime we're naming any event, right, a behavior like walking or a diagnostic category like major depressive disorder, or even things like this is a phone and this is a pen and this is a cup, anytime we're naming events and describing relationships among those events, that we're abstracting parts out of the unitary whole, that's a thing we're doing. And that all of it is a little bit artificial. All of it is a little bit of an artifact of where it is that we are and what context we are operating in as the person doing the naming, doing the describing, doing the theorizing or the diagnosing or the conceptualizing. And finally, contextualism takes a truth criterion, or holds a truth criterion that's really fundamentally unique. It's very different from that of the rest of science. For contextualists, right, we know that something is true, not capital T true, but like little t true. We know that something is true when adopting that perspective as true, that diagnosis, that term, that label, that story, that narrative, that conceptualization, that we can treat it as true when it works. I'm going to lean a little bit more into that truth criterion piece. Right, so there are three basic ways that Pepper talks about truth. He talks about coherence, correspondence, and successful working. If we start with correspondence, it's the idea that our stories about the world, the way that we talk about and conceptualize and label and name the events in the world, that they are good, they are true if they match. So the job of science would be to make our words about the world match the actual world. Pepper also talks about coherence, right? The idea that our stories about the world have to fit with other stories about the world and with observations at lots of different levels, right? If we zoom out or if we zoom in, that we can't have stories that are incoherent. They all have to fit with each other. The system of words that we wrap around our observations has to be a coherent system. Now, neither of these are what we primarily hold in contextualism, that truth criterion is successful working. But before we spend a bit more time with that, I want to emphasize that we are always doing coherence and correspondence. Right, so even as I'm talking to you right now, even as you look at your phone and realize that someone's calling you or see an email pop up and you are naming and interacting with the world, that we're always treating our language, our understanding of the world, as if it's got to match a true world, a real world, a reality that maybe we can never access, but that the better and better our stories are, the more it will match. We also, right, we don't like things to be coherent. We like for our stories about the world to hang together. That's naturally reinforcing for us, right? We want our stories and our narratives about things to fit with one another. So we can never truly abandon those. But in contextualism, our emphasis is on how that story about the world works, how that narrative or that label or that diagnosis or that conceptualization, how it works, how it serves us in our goals. can almost imagine the traditional position that emphasizes correspondence and coherence to be treating our stories or our terms or our narratives, to be treating those as mirrors, right? That if there was a job that you wanted to do, you wanted to hammer in this nail, and you knew that you could never really see the nail or the hammer directly. You've got sensory limitations, you've got bias, you're only located in one place at one time, you can only observe one thing at a time, right? If you had kind of knew, you could never really see the world, but you've got your ideas about it, right? Your theories, your terms, we've got all of that narrative about the world that we could ask ourselves if that's true in terms of how well it reflects the world, right? How good of a mirror it is. So if we needed to do some work like hammering in a nail, we can imagine ourselves sort of turning the mirror this way or that, or over time, the progress of science involving kind of banging out the warps in that mirror, making it flatter and more pristine so that it could more accurately reflect the world. This is the progress of science when we hold correspondence central. And this is a little problematic at times, right? If we imagine that the world is complex, if we take a process-based orientation, then one of the things that happens is it quickly becomes overwhelming to the extent that we make the parts primary. You can almost imagine that we would have to have as many words or labels, right, as there are unique events in the world. And if we take those unique events in the world literally, then you can imagine you'd have a proliferation of diagnostic categories. You'd have a proliferation of unique words until we had as many words for things as there are events themselves. So if we apply this to diagnosis, for example, right, the way that those diagnostic categories would move in this correspondence approach to truth is that eventually our mirror would have to be just as complex as the world itself. In other words, I might have Emily Sandoz disorder, and that would perfectly predict the way that I struggle in the world. It would be the perfect label. It's not super practical, right? And we, as therapists, as interventionists, we're interested in practicality. There's another approach, and that's still acknowledging that we can never really see the world directly, right? Still acknowledging that our stories about the world are imperfect reflections. But in this perspective, this kind of successful working or pragmatic truth criterion, we say, stop, hold up. What if our terms, our theories, our narratives, our conceptualizations, what if they're not mirrors at all? What if they're hammers? What if the second that I label something, the second that I peel some event out from the whole, the second that I name it, describe how it relates to other things, slap a diagnosis on it, build a narrative around it, write a report, construct a conceptualization. What if at the moment that I'm doing that, I'm already interacting with the world? I'm already doing the work, right, on the subject matter, just in the moment that I begin to narrate about it, to formulate those reflections, to formulate those conceptualizations or stories about the world. So from a contextual perspective, this is how we approach our stories, our narratives, our labels, is as hammers. And just like we could look in the mirror to try and see if we're getting the hammer and the nail in, this perspective sort of says, like, what if we instead closed our eyes and started banging up and down? Do you think we could tell if the hammer was hitting the nail? Do you think we could tell if it was the right hammer? Like if you had a few there, like a big sledgehammer and a little tiny pin hammer, do you think that you could tell which one helped you to get the nail into the wood? Do you suppose that you could attend then to the relationship between your process and the world that you're trying to interact with in a way that could directly feed back to what it is that you're doing in any one moment. There is a whole perspective then that takes this, this stance, and that's behavior analysis. But actually, before we go there, let me give one more example, and that's that, in the room, I want you to try this on. This idea that in the therapy room, we could pause and consider our ideas and ask ourselves how those ideas are going to inform our work. We could try to know first in order to do, or, right, we could do in order to know. We could approach the act of doing therapy in a way that centers our process and our behavior as a way of understanding the client's behavior, and the client's process as a way of understanding our behavior. That interaction between hammer and nail, not being perfectly directly accessible, right? But being there for us to perceive in an iterative way, to build on our actions from one moment to the next, to move us towards our goals. Of course, there's a whole scientific perspective that's based on this. We might discriminate the two between playing the function game and playing the correspondence game. So the function game is when we'll attend from moment to moment in the therapy room how our behavior is influencing the client's behavior and vice versa, and how attending to that functional relationship, letting that guide our behavior. We'll call that playing the function game, and it's centering a pragmatic truth criterion. Of course, the alternative would be playing the correspondence game, or correspondence and coherence game, which we said we can never stop doing. We're always going to have ideas, and we'll always be trying to match those ideas to something happening in the room. When we find ourselves doing that, we can come back to playing the function game. This is the perspective that underlies behavior analysis. However, there's been some limitations in behavior analysis in terms of how easy it is to disseminate, how accessible it is for folks that don't have a lot of training working in the basic laboratory. And it can be difficult for us just in general to take a functional perspective. We're used to really leaning hard into words in our stories. If my husband says, I'll be back at 4, do you think you could have this ready for me, a sandwich ready for me, right? Those words are supposed to organize my behavior in a very real way. I'm supposed to treat them as if they mirror a real world. So we're used to taking words and playing correspondence with them all the time as the only thing that we do. I could also look at my husband's request to have a sandwich ready for him at 4 and ask myself, what is happening between us right now? Like maybe he's giving me an opportunity to love him, or maybe he's communicating that he's felt left out, or maybe he's asking for me to be around, more this afternoon, or to think about him during the day. Or maybe he's feeling close or vulnerable. Right? There is something happening between us right now that is not about the match between the word sandwich and an actual sandwich, or the words 4 o'clock and the actual time of 4 o'clock. So how do we understand or unpack then this conceptual model, this mid-level model? I'm going to suggest that one of the things that this mid-level model does, like any mid-level models, is that it actually pulls for the correspondence game. It actually is hard to treat this flexibly, right? If I'm working, trying to categorize, is the client fused? Is that the best word for what's happening now? Is the client avoidant? Is that the best word for what's happening now? That I can easily get stuck in correspondence and forget to come back to the interaction between me and the client. our hope, I think, is that the mid-level terms sensitize us to the basic science and to the philosophical foundations. And I'm going to suggest that what mid-level terms do almost universally instead is that we tend to put them inside the person. We tend to approach these terms in ways that don't have immediate implications for us. So you might find me saying a client is really fused with their deprecating thoughts about themselves, or that client is really avoidant. And when I'm doing that, I'm taking this observation of how the client interacts with the world, or more accurately, how the client is interacting with me in therapy as an ongoing behavior. I'm taking that observation and smashing it up into one word and then tucking it inside the client as a way that they are. This isn't the best way, I think, to act flexibly and in a way that's sensitive to ongoing process, to ongoing changes in the client's behavior, and to our ongoing, their changing needs over the course of the therapy relationship. So we could approach therapy. One way that we could approach it, learning any therapy, ACT included, is as if we were putting together IKEA furniture, right? So the client could come in and we could sort of lay out what all the pieces are. How fused are they? How avoidant are they? What are some things that get them fused? How good are they at settling into their bodies? What's their content around self? We could sort of categorize and write a story about the client. And then we could pick up a protocol that best matches how they are struggling and the words we've wrapped around it with, some category from the protocol. So ACT for anger, or ACT for highly conflicted interpersonal relationships, or something like that. And we could try to match. Day after day, module after module, we could try to match what we're seeing in the room to what we'd see in the manual, just like putting together IKEA furniture, right? At any moment, you can lay out all of the different screws that you have and the different bolts, and at any point, you can check and see, does this table look like the table in the picture? Am I doing good work? And what you should hear is that correspondence game piece. That idea that in a moment-to-moment way, one of the things that we can do, and that we kind of do without meaning to, is compare what's happening in the room to some idea of what should be happening, of what the protocol says, of what fits with this diagnostic category or that. So this correspondence game in the therapy room involves any time we are comparing what's happening in front of us to some idea. Right, to some category, to some narrative, to some understanding, where we find ourselves knowing in order to do. So that's playing the correspondence game. And there's an alternative. When I look at folks who do really beautiful, really masters, and they're doing this flexible, sensitive work, it feels artistic. It feels a lot less like putting together IKEA furniture and a lot more like throwing pottery. If you think about pottery as a metaphor, in some ways the IKEA work looks more complicated. There's big bags of, lots and lots of screws, and there's so many pages to the manual. And, if you look at the parts that are involved in pottery, there might be a handful of tools. There's really the clay, a little bit of water, and your hands, and the table, that little bit of context. It looks a lot more simple. And yet, if you think about all of the things you're interacting with, they're not bolts and screws that impact what you need to do in any one moment that you're trying to work on directly, right? Instead, they're aspects of those things, those three things we said, the table and the clay and the water and the hands, that's four. They're aspects of that. So what matters about the clay? Well, it's composition, right? What minerals are included in it and how finely ground those minerals are. And not just what you're observing now, but also like where the clay came from and how it was shipped and how it was packaged. Like all of those things might influence how the clay actually responds when you begin to mix it with water, when you begin to spin it around on the table, when you put your hands on it. Right? All of those little characteristics of the clay will come to interact with your movements, will be responsive to them. And it's not just the clay, right? You've got you as a major factor for what happens to the clay. You're spinning the wheel, maybe working a pedal with your foot. That will be influenced by, whether you ran a mile yesterday or if your shoes have been uncomfortable and maybe you've got some new ones that haven't fit quite right, right? And not only that, right? Your hands themselves, your body temperature, how moist your hands are, how much water you had yesterday, what you had for breakfast. Maybe if you did a lot of typing or writing or playing the ukulele, right? All of those things will influence how it is that you move, how accessible certain moves of your hands and your fingers are to you. Right? And we could go on and on to things that don't even look related, like if your mind wanders and if you've been stressed out that day, or if the air is humid. I live in Louisiana. It's like hot and very humid all the time. So it might be 99% humidity. I will have to interact with the clay differently, right? If I'm throwing it in Louisiana than if I'm throwing it in Poland. So all of those things matter. In fact, what looks very simple is really deeply complex. And if there was a manual like there is for IKEA furniture, it would have so many columns and pages and reference, like if it's this temperature outside and it's this humidity and your body temperature is this and you're working with this kind of clay, do this in the first moment and this in the second and this in the third. By the time you were able to read what you were supposed to do, the moment would have passed and the clay would have crumbled beneath your hands. Instead, what the potter does is gathers up the clay, right? Gets it nice and wet, gets it responsive to their touch. And then the potter begins spinning the wheel, and working the clay, puts their hands on it and slowly kind of finds their way. And what that potter is attending to is the relationship between their moves and how the clay responds, that interface between them and the clay. And they're attending in a moment to moment to moment way. And when they find themselves comparing to some idea, quite often what happens is that the clay will crumble. Right? If they spend too much time there. I'm going to suggest that for us to do really flexible, like customized acts that's sensitive to the human that's in front of us and where they're at that day, how they're proceeding through life that day, we need to attend to the same, to the functional relationships between our behavior and the client's behavior. We should be watching how the client is influencing us and how we are influencing the client as an ongoing thing, as a constantly changing thing. I said earlier then that this is the distinction between this is a distinction that we can bring into the room. So I'll invite you, this will be the first little bit of compass that I'll offer you, is in your work from here, when you're watching tapes of yourself doing therapy or watching one another do therapy or doing practice role plays, you might ask yourself in any one moment, are we playing the function game or are we playing the correspondence game? That's our first little compass point there, based on our philosophical orientation. I also mentioned that behavior analysis comes right out of this functional or pragmatic truth criterion, that behavior analysis is all about playing the function game. The words that we've offered in behavior analysis haven't always been accessible. So instead, I'll offer you a simplified version, still technically precise, and something that for me has worked better in the therapy room. So I'm going to suggest to you that we can sort of bring a behavioral perspective to bear on our therapy interactions with just 5 words, little 5 categories. We're really making first 2 distinctions, maybe 3, and then 1 more distinction. Okay? So the first is that I'm going to suggest to you that all of the words and all of behavior analysis can kind of fall into 3 categories. They're either behavior words, they describe behavior, they're context words, they describe the context in which behavior occurs that influences the behavior, or they describe function, the functional relationship between context and behavior. Let's start. I'm going to sort of walk through each of those. So what do I mean by behavior? By behavior, I mean everything an organism does, right? If we bring this contextual perspective to bear, I'm thinking of the behavioral stream as unitary, that in any one moment, there's multiple things that we're doing, maybe functionally an infinite number of things that we're doing, that we're engaging in, and that it's a stream in terms of it constantly changing from one moment to the next, to the next, to the next. You can hear that act in context. So we've got this behavioral stream that's unfolding, and just like an actual stream of water, we've got different currents in the stream, right? And so they're co-varying. These up here may be more closely co-varying, and then there's some behaviors that are more independent from those behaviors. But as we peel out specific events from the behavioral stream, we can also look at how those behaviors are related to one another. From this perspective, then, the behavioral stream is ongoing, made up of lots of currents. The stream itself is unitary, and all of those currents are interdependent to greater and lesser extents. But for us as behavior analysts, we're not going to call any of those behaviors causes for any other behaviors. And it's not about correspondence or what's real or true. For us, we're playing the function game, right? So for us, we're not going to call behaviors as causes for other behaviors because we are interventionists, we're therapists. We don't live inside of the behavioral stream, right? When we're trying to influence somebody else's behavior, we live in what I'll call the context. And so from this perspective, context is anything outside of the behavioral stream, but that comes to co-vary with it, that has a relationship with behavior, where when the context changes, behavior changes, and when behavior changes, the context changes. And just like there are an infinite number of ways that we could split the behavioral stream, there are really an infinite number of ways that we could split or describe the context. Again, not relying on correspondence here, right? But instead, on function, we'll abstract certain aspects of the context out that tend to co-vary quite nicely with the behaviors we're most interested in. So just like the behavioral stream is unitary, we imagine the context is unitary and acknowledge that it's workable to peel out certain aspects of context and to see how those relate to behavior. The third category of terms are function terms, and we're just going to talk about function for a moment. Function is very simply the relationship between context and behavior. We've said a context is context for a behavior to the extent that it co-varies with that behavior, and that a behavior has a relationship with context to the extent that it co-varies with that context. That relationship, that co-variation, is what we're calling function from this perspective. Right? So if we say, what is the function of a context, we're saying what behaviors occur in that context. And if we're saying what are the functions of that behavior, we're saying in what context does that behavior occur. From this perspective, function is bidirectional then. So behaviors are everything that is happening, everything that the organism is doing now and now and now and now and now, and we can peel out certain pieces of that to analyze or attend to. And context is everything that's happening around the behavior, but with it now and now and now, and we can peel out the parts that we can see and push on quite easily. And function is the relationship then, right? What is happening between context and behavior? And because we're humans, when we apply this in the room, right, we can think about context very broadly, right? We can notice that all of the client's behavior that we're observing, all of that behavioral stream that we're observing, that's happening in this context, the context we're creating, and that we are the context for their behavior, even though all we're doing is sitting here and talking, that functionally speaking, if we look at the relationship between that behavior and the context we're creating, we can understand those behaviors functionally. And it's functionally similar to behaviors that are occurring outside of the room. And not just that, but of course, it means that we can use language to bring in context from outside of the room that aren't physically present. That we can use our words to create contexts that are very similar to those outside of the room. The job then might be anything that we want to observe the client doing, create the context to make it happen. If I want to better understand, the client's anger and how that functions, then I might bring into the room with words context that make that client angry and observe what happens to their repertoire as I change the context. It also means that if I want to observe how the client orients to possibility or to hope or to values, I can use words to change the context and watch how their behavior responds. This is how I think of contextual, or rather clinical behavior analysis. This is what I think defines clinical behavior analysis, is that we are focused on direct observation and intervention. We're not writing stories about what the client has done and using those stories to offer a conceptualization and then make a plan, or to teach a lesson and then make a plan. We can do that, but it's not the heart of our work. That the heart of our work is in direct observation, right? Is in direct intervention. It is in creating the context in this moment for the client to engage in the behavior that is problematic out in the world, and for me to watch it happen right there in front of me with my hands on the clay, and to gently add to the context to see what else I can get the client to do here, training skills directly that might be useful to them out there. From this perspective, it's not about hoping that the behavior that I observe in here, that I teach in here, is going to be brought out there. It's my job as the interventionist to manage the context in a way that brings that behavior from out there in here. So we are creating the context for maybe inflexibility from an ACT perspective. We're using words to shift this immediate context to get that inflexibility to happen, right? And then we're adding to the context without taking that aspect away. We're adding to the context to build flexibility around that topic or issue or whatever it is that gets the client inflexible. So even though there's an infinite number of behaviors and an infinite number of contexts, and so there could be an infinite number of functions, we're not really interested in the infinite number of functions. We are going to characterize function. This is our next final little distinction here. We're going to characterize function in terms of appetitive or aversive. This is probably quite familiar to you, in fact, even if you don't use those words. So basically, we can describe any functional relationships between context and behavior as an appetitive relationship or an aversive relationship, or that it has an appetitive function or an aversive function. Now, if you've done work with the ACT matrix, you may have heard moving toward or moving away. If you have a strong behavior analytic background, you may have heard positive reinforcement and negative reinforcement. But in here, we're going to take a one step past just talking about is the person getting away from something, or is something being taken away from the context? And is somebody moving towards something, or is something being added to the context? And instead, we're going to look at how these different repertoires function in terms of the whole behavioral stream that's unfolding from this moment to that moment, and how it's interacting then with the context. So on the aversive side, right, we said aversive behavior under aversive control, or behavior that has an aversive relationship with the environment, is about running, fighting, and hiding, right? It's our survival behaviors, right? And, you know, we can think about how running, fighting, or hiding impacts our whole behavioral stream. When we are running, fighting, or hiding, when we're navigating away from aversive context or from threat, that our whole behavioral stream becomes narrow. The number of behaviors that are available to us shrink down and become few. Not only that, but that behavioral stream becomes rigid. The context can be trying to change and we're not responding to the changing context. It almost becomes pressured or rigid in its lack of responsiveness or sensitivity. And because behavior and context are of a kind, right, as the behavior narrows and becomes insensitive to context, functionally speaking, the context has narrowed. It becomes oversimplified. There are only a few aspects of context that are influencing the behavior at any one moment. You might imagine the person who struggles with panic, you know, as the environment starts to shift and panic starts to come up, gradually the world shrinks and the only things that matter are maybe some things to monitor, like my heart rate, you know, maybe some scary things around me, and escape. And that's it. I might not notice a butterfly or a smell on the breeze that reminds me of my childhood, or that my daughter just sent a text with a big heart. None of those things are part of the context, because my world is about getting away from the threat, is running, fighting, or hiding in a way that narrows the repertoire and really the whole interbehavioral field, the context, the behavior, and the functions. From an aversive learning standpoint or mode, right, you have access to more aversives, access to more ways of avoiding, but without intervention, very little access to other kinds of behaviors and other kinds of contexts. And not only that, but it's cumulative. The better you get at aversive learning, the better you get at aversive learning. You can come to avoid threats that are not even threats, but symbols of threats, or symbols of symbols of symbols of threats, right? We can come to interact with things, anything, as if it is aversive. In other words, any aspect of our world can come to narrow our repertoire, can come to narrow that behavioral stream and make everything tight and rigid. Fortunately, though, the same thing is true on the other side. All of our learning, all of our interactions with context are not just about running, fighting, or hiding. There's also a whole other aspect of functional responses that are about seeking and exploring and engaging. Right? And when we are seeking and exploring and engaging, we are doing so in ways that make the behavioral stream big and fat and flexible. Our behavior can easily come under control of different aspects of context and is sensitive broadly then to lots of different things going on around us. when that behavioral stream begins to become appetitive, the better we are at appetitive control or appetitive learning, the broader the context becomes. So our repertoire gets big and fat, our behavioral stream gets big and fat, the world enriches around us and becomes more complex and complicated. And not just that, but as we grow, as we become better and better at appetitive learning, right? We get better and better at appetitive learning. More things can become appetitive to us. More aspects of context can be the kinds of context that broaden our repertoire and that get us seeking and exploring and engaging. And I think this is the work of acceptance and commitment therapy. That this is what we're doing in the therapy room. That we are holding the context, like hands on the potter's wheel, hands on the clay. We are creating a context for the client to engage in behavior under aversive control. We are intentionally, right, making the relationship, at least temporarily, between us and the client, making it a little bit aversive. We've got to make sure we have an appetitive relationship to begin with, that we've got some foundational, functional appetitives in the relationship to where we can bring in some aversives. Remember, using words, we can bring in anything that happens outside in the world, anything that has happened or that we fear happening. We can make that present simply by wrapping words around it. Right, and then we can watch the client's repertoire narrow, and without removing that aversive, we can bring to bear appetitives to broaden out that relation or that behavioral stream. Right, so we've got the aversive present. We can use instructions that are appetitive, or invitations or suggestions for exercises, and we can give people the opportunity to practice things that they're already good at. That is inherently appetitive. We can contact things that are pleasurable. We can bring contexts that are valued or meaningful. And that basically what we're after is creating a context in a moment-to-moment way in the therapy room itself, creating a context right here in the room that's appetitive enough that flexible learning is happening, right? But aversive enough that it's really going to matter in the places in our clients' lives where they struggle the most. You might imagine that over time, we're gradually fattening up the repertoire, getting it big and fat, getting the client nice and flexible, not as a thing inside the client, as a thing that's happening between us, and then adding some aversives, and we start to see the repertoire narrow. We see the behavioral stream become more tight and rigid, and then we catch it, and a few more appetitives here. We broaden it out. And over time, what we'll do is we'll get better and better at learning for this client, right? What's a few behaviors from the behavioral stream that can tell me that this relationship is currently aversive or appetitive, that the functions in the room are aversive or appetitive? What can I look for in that complex behavioral stream that can be a big clue for me? Because it's going to be different for every client. Some of my clients, when they're talking a lot, that is a sign that we are under aversive control, that our relationship is aversive at that moment. And some clients, if they're talking a lot, it's clear that it's appetitive, right? So we got to assess over and over and over for these clients what appetitive control looks like on their behavioral stream and what aversive control looks like on their behavioral stream. And there are particular behaviors that we can train then. And I think this is where that mid-level model tries to start, right? So at any one moment, we said we've got an appetitive enough relationship that we can bring in aversives without losing the client altogether. And so we bring in hard things from people's lives. We ask them about what the worst part of yesterday was, or ask them, what the difficulty is, that they look anxious, whatever it is. We bring in that aversive. And then we add to the context in a way that expands their repertoire. And we can do so in a way that's consistent with our mid-level model. We can ask people to take a moment to check into their bodies. We can ask people to observe their thoughts. We can ask them to lean into a difficult experience or to notice something sweet and to approach that. We can ask them to orchestrate a series of actions, to plan things that they could do to contact more of that meaningfulness or sweetness. We could have them practice perspective taking or seeing themselves in broad and flexible ways or occupying a pure perspective. Or really, this could be the foundation for any model. It doesn't have to be just ACT, for any approach that we want to do from a contextual behavioral science perspective. So I think this is really where the mid-level model comes in, is it provides us target behaviors. Instead of it being a thing inside the client, this client is fused, we can say, I'm seeing fusion now. And then we can give the client the opportunity to practice diffusion or observing their thoughts. So it might be something like, as you remember what happened last week, I'm wondering if your mind has something to say here, right? To the extent that that's an appetitive instruction, the client will try a new behavior, right? And then we might contact something meaningful following that. We might tell them good job. We might give them a chance to practice something easier, gradually shaping that repertoire so they get better and better at appetitive learning in the context of things that were functioning as aversives, or better and better at psychological flexibility. So this last little bit, and then I'll be shutting things down on my end, but this last little bit is an opportunity, again, another piece of compass here, an opportunity for you to check in. Think back over your clinical work over the past week, over the past year, over your development as a therapist, to something to guide when you're watching sessions, tape of your own sessions, or observing a peer or a supervisor or a supervisee, to ask yourself, what is happening now? What is the behavior that's occurring right now? What's standing out for me from the behavioral stream, like the clay in front of me? And what context is the therapist creating? What aspects of what they're doing are co-varying with that behavior in a way that speaks to its function? Landing on what is the functional relationship between what the client is doing and what the therapist is doing? How appetitive does that relationship feel? How broad and flexible? How easily is the client responsive to different aspects of the therapist's instructions or suggestions or congratulations or invitations or expressions? Or how aversive is it? How narrow and rigid, right? How insensitive to what the client, or the therapist rather, is trying to do.